Picture this. You eat a delicious meal, your body breaks down the food, and sugar or glucose enters your bloodstream. This is where insulin, a hormone produced by your pancreas, comes into play. Think of insulin as a key that unlocks the doors of your cells, allowing glucose to enter and provide energy. However, sometimes your cells become resistant to insulin's message. The key no longer fits the lock as well, and glucose struggles to enter. This is known as insulin resistance. As a result, sugar builds up in your bloodstream, increasing your risk of serious health problems like type 2 diabetes, heart disease, and stroke. Insulin resistance is a growing health concern affecting millions worldwide. The good news is that it's often reversible with lifestyle changes and, in some cases, medication. Understanding the causes, symptoms, and management strategies for insulin resistance is crucial for safeguarding your health. Several factors contribute to insulin resistance, often working in tandem to disrupt your body's delicate metabolic balance. One major culprit is excess weight, particularly around the abdomen. Fat cells release substances that interfere with insulin signaling pathways, making your cells less responsive. Genetics also play a role, as you may inherit a predisposition to insulin resistance. If your parents or siblings have it, you might be at a higher risk. Age is another factor, as insulin sensitivity naturally declines as we get older. Lifestyle choices heavily influence your risk of developing insulin resistance. A diet high in processed foods, sugary drinks, and unhealthy fats can lead to weight gain and inflammation, both of which contribute to insulin resistance. Conversely, a sedentary lifestyle exacerbates the problem by reducing your body's ability to use insulin effectively. Insulin resistance often develops gradually with subtle symptoms that can easily go unnoticed. One of the first signs is increased thirst and frequent urination, as your body tries to flush out excess glucose through urine. You might also experience unexplained weight gain, especially around the middle. As insulin resistance progresses, you might notice dark patches of skin on your neck, armpits, or groin. This condition, called acanthosis nigricans, is a sign of insulin resistance. Fatigue and difficulty concentrating are common symptoms as your cells are starved of energy due to impaired glucose uptake. High blood pressure and elevated triglyceride levels are other red flags that often accompany insulin resistance. These conditions, collectively known as metabolic syndrome, significantly increase your risk of heart disease and stroke. The good news is that you can take charge of your health and reverse insulin resistance through lifestyle modifications. One of the most effective strategies is losing weight. Even a small amount of weight loss, 5 to 7% of your body weight,